When in doubt, yank it out. What you may be asking, this. I just got back from the dentist. I've been taking a lot of pills, antibiotics, muscle relaxers, Vicodin, you name it, Valium. Why? Because of this. No, I have not discovered ancient ruins of some long ago species. These are not dinosaur teeth. These are my teeth. This tooth right here, the other day, while chewing, split in half. Look at this. Okay? That is not touched by the oral surgeon. It split in half like this. Can you see that? This is frightening. I had to deal with this for a week. Look at that. And that was the back molar, this one right here. And you can see it. It was pulled out. See it? Ah! Look at that. I apologize. You didn't see that. No, they did not use this. When in doubt, yank it out. Hey, I went and tried to get a root canal. I went to my dentist. Did you know that there's more than... You go to a dentist, he does a cavity, they do a tooth cleaning. If you need a root canal, you got to go to another guy, and they do the root canal. If the guy who does the root canal says, oh no, we can't save that tooth via the root canal, then you're going to be sent somewhere else to have it pulled out. Well, does this tooth look like it needed to be pulled out? This is what I was dealing with in the back of my mouth. Look at this. And it was cracked down the middle like that. Look at that. Now, my teeth are cleaner than this. I think they get a little crazy when you take them out. So I had to have that done. But before that, I had this tooth. This was on the left side. I pulled it out. Look at I have to eat. I had to eat mush. This was just done a few hours ago. I had to eat. Well, that's good mush. This is just mashed potatoes. That's all I can eat. This is how it started. On this side, I had this tooth. Perfectly fine tooth, except I had a little chip on this side. It was cracked, fractured. As you can see right here. This piece was fractured right. How's that go? Here it goes. Right there. See? So this little piece was fractured, and it was fractured all the way down there. And I went to the dentist. Then I went to the endodontist, I think, and he said, whoops, he said we cannot save this. You cannot do a root canal, so it needs to be pulled. So I went to that guy today, and he stuck these pliers in my mouth, and he pulled that out. And I had to get this other one pulled out because this one cracked because I favored this side because I couldn't use this side, and something happened on this one on the right, and this one cracked. What they do is they take you in there. They can numb you and pull it out, but he said, we're going to give you some anesthesia. Here, you come in, take some of these, take some of these, take some of these, calm you down, give you some penicillin. Guess what? It was perfect. I closed my eyes. They said, Mike, how you doing? Here, let me put this in your arm. They said, we'll see you in about an hour and a half. And I said, and I went down. Next thing I do, I woke up, and then I had to I have to just ice this down. I have to keep taking my pills. I have to eat mush for a few days. I had to keep this clean, and they just pulled them out. Now, do I want to not have teeth? No, of course not. But the pain I was having with this back tooth that's cracked was the worst pain I've ever experienced in my mouth. So I'm thrilled. I don't feel it. I don't feel it at all. I feel a little swelling from when they yanked it out, but not that bad. Of course, I'm on Vicodin. Where is that stuff? Oh, yeah. This is good stuff. But that's besides the point. What could I have done to prevent this? That's more to the point. That's what Live Life 365 is about. I asked my dentist. I said, was it diet? Am I not getting enough calcium? Is it because I'm a vegetarian? Am I missing something? He said, no. In fact, it's good that you're a vegetarian. Your teeth are healthy. You've got very, very healthy teeth, Mike. You've got a healthy diet, which keeps your teeth good and nice and clean. You don't, and you floss all the time. You have tremendous teeth. What probably caused this, besides old age, you know, and then your teeth wear down over the course of years, was that he said, do you grind your teeth a little? Do you clamp down? And I said, yeah, I do that. It's just a bad habit. I just clamp down a lot. He says, well, if there's a little, like any kind of fracture, if you think about it, if you have a little, you know, little weakness in any part of your body or any part of a building or a structure, if you keep pressing it, keep putting pressure on it, eventually it's going to crack. And he said that's what happened to your teeth. And what probably happened to this one on the right, this one right here, was that it was going to go sometime, but you probably accelerated it because you put a lot of pressure on that one. That one split. This one, like I said, was a relatively healthy tooth. Look at these roots. Look at that thing. But just that little chip that did it. That was cracked. That was cracked for a long time. I used it for a long time. But always take care of your teeth. Even if it's something like this, you know, I always hoped that it was something I could avoid. I ate a lot of almonds and stuff. He says, no, it's not your diet. It's just some teeth are going to go, especially if you put a lot of pressure on them. So think of ways maybe to meditate, to relax, to loosen up, so you don't have to worry about things while you're sleeping, because that's when a lot of the clamping is coming down. Or wear a bite guard, put a little bite guard in your mouth, and sometimes that'll help you. Your teeth will live longer, to last longer. But mostly just, he said that I was a healthy guy. That's the most important part. I had a little surgery today, and you know, he did not use this. He pulled these out. I'm relegated to mush for a few days, but it's not much different than what I usually eat. I got my friends. I decided to let you know. Peace. Baby.